And so what starts arthritis? Where does arthritis come from? And it's a great question. And it's either related to an injury or trauma to the cartilage, something like a sports injury, for instance, where the cartilage becomes damaged, the cells in the cartilage are sick, they start to secrete the inflammation. The second way that it happens is just with age. So cartilage cells, like every other cell in your body, will tend to become less effective as it gets older. And in many cases, those older cartilage cells will start to secrete the inflammation. But either way, the process starts by the cartilage cells secreting this inflammatory chemicals into your knee joint. And then in turn, those inflammatory chemicals actually make the process worse. It becomes a vicious cycle because then that inflammation makes the cartilage weaker. And to make it even worse, when little pieces of cartilage come off and float around in your knee joint, sometimes they'll get into the lining of the knee joint, what we call the synovium. And that can be very irritating to the synovium. So then that becomes inflamed. And then that starts secreting more inflammation into your knee joint. So it's all a very vicious cycle, and it's very, very difficult to stop once it gets started. In fact, the hard thing with arthritis is that we don't have a cure for it. We don't have a way to stop the process necessarily using conservative treatment options. And I am going to say that this is for osteoarthritis, primary osteoarthritis. I am excluding and not talking about other kinds of arthritis that can be inflammatory or autoimmune. They are a separate issue altogether, but regular run-of-the-mill osteoarthritis is what I'm talking about. So most of the treatment for arthritis is non-surgical because we don't know how to grow the cartilage back. And so the only thing we can do is modify the symptoms. And so the traditional treatments for arthritis are not disease modifying. We're not stopping the process. We are only trying to get the symptoms better. And we do that with activity modification. Bracing can be effective. Strengthening up the joint can be very helpful. Eating right, losing weight so you have less weight on that joint. And then we get into medications that control the symptoms. And the primary medications are going to be for inflammation. And the most common are what we call the non-steroid anti-inflammatory medications. And that would include things like ibuprofen, Advil, Aleve. Those medications do reduce inflammation. They help with the symptoms. But if you're on anti-inflammatory medications for long-term periods of time, it can mess with your heart, it can mess with your stomach and cause reflux and stomach ulcers, it can mess with your kidneys. So these are not medications which are great to take long-term if you can avoid it. And even worse, other anti-inflammatories that are even stronger would be steroids. So prednisone is an example of an oral steroid. Very strong anti-inflammatory, can really help with the symptoms of arthritis, but the side effects of long-term steroids are even worse than the non-steroidal anti-inflammatories, so that is not a long-term strategy either. Injection therapy can be very effective, especially in the early stages of arthritis, and the first injection that's the most common would be cortisone. And cortisone is a steroid that we inject into the knee joint. And in many cases, one injection of cortisone can break that inflammatory cycle, and it can last patients a really long time. For those patients that don't get a lot of relief from cortisone, it is not advisable to keep injecting cortisone because cortisone, although it can be very effective short term, multiple cortisone injections will actually cause more cartilage damage and make the process worse.